Sclerosing cholangitis. Primary sclerosing cholangitis is an important topic, and here the sclerosis happen in the bile duct. In primary sclerosing cholangitis, the sclerosis happen in the bile duct. So bile duct situated mainly in two parts. Suppose this is a liver and this is outside of liver, so the bile ducts are coming from liver because the bile formed in the liver. So bile duct forms from liver and then it comes outside the liver and it drain into the gallbladder. Okay, so parts of bile duct situated in the liver, that is called intrahepatic duct, and the parts of duct situated outside the liver, that is called extrahepatic duct. Okay, so primary sclerosing cholangitis, it means the sclerosis happen in the bile duct and in intrahepatic and in extrahepatic. So sclerosis happen in an intrahepatic bile duct, also in extrahepatic bile duct. So that is called primary sclerosing cholangitis. Okay, so here this is liver and this is the bile duct. So all their sclerosis happen. So the ducts are constricted. Due to constriction, the bile cannot drain, or the required amount bile or the formed amount of bile in the liver cannot drain in the gallbladder. So the bile is accumulated in the liver and toxicity occur. So first of all, primary sclerosing cholangitis, it is a sclerosis or fibrosis of intrahepatic plus extrahepatic bile duct. Due to this constriction, bile formed amount of bile cannot drained in the gallbladder. Okay, gallbladder. That's why. So this toxicity happen in the liver. So inflammation in the liver, and as a result cirrhosis of liver occurred. Okay, so this is the consequence of primary sclerosing cholangitis. And most important a very important thing is the primary sclerosing cholangitis, or PSC, is associated most of the cases associated with ulcerative colitis. Okay, so this PSC, or primary sclerosing cholangitis, is associated with ulcerative colitis, and in 95% cases this association happen. Okay. Then males are more involved. Male is to female, so it is a risk factor for male 2:1. So what are the clinical features now? Clinical features. Now the clinical features, number one. So bile cannot drain in the gallbladder. That's why liver can be palpable. And pain abdomen. Then infection can be happen. So that's why fever occur. Then jaundice and biles are accumulated. That's why pruritus. So, and 6, fatigue, metabolism altered. That's why fatigue. So these are the clinical features of primary sclerosing cholangitis. Can be liver palpable, pain abdomen, fever, jaundice, pruritus and fatigue. Then investigation. So investigations. Number one is in investigation LFT done. In LFT, so LFT, the features like cholestasis seen, increase in ALP increases, and AST and ALT both are dearranged. Okay, both are dearranged. Then bilirubin level increased. Bilirubin level also increases. And then treatment. Also we can investigation by MRCP. Through MRCP we can diagnose this, and in most of the cases the ANCA will be positive. In 95% cases the ANCA will be positive. Okay, then last is treatment is the treatment of choice is liver transplantation. Liver transplantation. Then the bile cannot drain in the gallbladder, so from gallbladder the bile cannot go to the intestine. That's why fat are less absorbed and fat soluble vitamins are decreased. Fat soluble vitamin decreases, so we can give as a treatment fat soluble vitamin. Then ursodeoxycholic acid UDCA, then cholestyramine. So ursodeoxycholic acid and cholestyramine, these are not as a treatment of choice, but these drugs can slow the progression of disease. So this is primary sclerosing cholangitis.